Hello, good day to you. It's Talkin really. I was a bit dubious about this story because I didn't know whether it would go into a story on its own, which it will do, or whether I should have it in Anyone Surprised by This? Because is anyone surprised by this story? The story is not shocking at all. I have reported about DNRs in care homes, and I have reported about DNRs for people with learning difficulties. But when you put them together, the headline comes out like this. There's been a huge increase in deaths of people with learning difficulties and disabilities in care homes during this pandemic. The number of people with learning disabilities dying in care home has more than doubled during the pandemic, according to new figures from the Care Quality Commission, the CQC. Their analysis looked at all deaths notified between 10th of April and 15th of May from providers registered with the CQC who provide care to people with a learning disability and or autism. And what they discovered was, the data shows that between 10th of April and 15th of May, 386 people, some of whom may be autistic, died who were receiving care from services which provide support for people with a learning disability or autism. And for the same period last year, 165 people with a learning disability, some of whom may be autistic, died who were receiving care from services. This is a 134% increase in the numbers of deaths this year. New data should be considered when decisions are being made about the prioritisation of testing at a national and local level. Now, of those 386, 206 were as a result of suspected and or confirmed COVID-19 as notified by the provider, and 180 were not related to the COVID-19. So 184 were receiving care from community-based adult social care services, and 195 were residential social care settings. In other settings, asterisk, meaning it could be anything, where they were notified of deaths, number in each setting was less than 5 people and cannot be reported for confidentiality reasons. The Chief Inspector of Adult Social Care at the CQC, Kate Teroni, said, "Every death in today's figures represents an individual tragedy for those who have lost a loved one." Whilst we know that the data has its limitations, what it does show is a significant increase in deaths of people with a learning disability as a result of COVID-19. We already know that people with a learning disability, I think they're referring to people with Down syndrome, are at an increased risk of respiratory illnesses, meaning that access to testing could be key to reducing infection and saving lives. These figures also showed the impact on this group of people is being felt at a younger age range than in the wider population, something that should be considered in decisions on testing for people of working age with a learning disability. And as we know, there was some issue about this with people being forced into having a DNR, do not resuscitate. So how many of those, I would love to know how many of those that died, the 386 this last period, had a DNR. I would love to know that. Maybe we should do a FOI request and find out. It would be very interesting. There you go, that's today's story. Do come back again, and don't forget, keep watching, because the numbers of views have gone down considerably this last couple of weeks. We're not even reaching 100 on every single video, so it's becoming very perplexing as to why. Anyway, have a good day and bye for now.